Hey guys, good morning. Dan Buglio with Pain For You. In this video, I just really wanted to talk to you about some of the strange things with regard to the mainstream medical approach, or the common practices used for treating pain or attempting to treat pain. So did you ever notice that the recommended treatment for your pain and symptoms absolutely depends 100% on the type of pain specialist you go to? So you go to your general practitioner, what are they going to recommend? Probably muscle relaxant, drugs, maybe some rest. If that doesn't work, they're going to pretty much recommend referrals to other specialists. So a chiropractor will do manipulation. A massage therapist will do massage. A physical therapist will do stretching and exercises. You go to a surgeon, they're probably going to recommend surgery. So it is really funny that, and I could probably go on and on with other examples of that, but how many different specialists have you gone to that all recommend different treatments for your pain, when in fact you've got one thing that's going on? You've got pain. Let's say it's lower back pain. How can it possibly be accurate that you can have 5 recommended treatments from 5 different specialists for lower back pain? Which one's right? I'm here to tell you they're probably none of them are right. And if they were, it would work. So at best, you're going to get temporary relief from your symptoms with any of these treatments. Spinal injections, injections into joints, those things, the steroids, they work for a short period of time, but then it goes away. But all you're really doing is masking the symptom. Are you truly treating the cause? So really ask yourself, how is it possible that one symptom can be treated an infinite number of ways depending upon the specialist you go see? It really doesn't make sense. And the reason none of their treatments really work in a lasting way is because they're all trying to treat the symptom, the pain, and they're not actually getting to the real cause. So next time you're shuffling off to the new specialist, pay attention to how their recommendation and even their diagnosis differs from the last guy or gal you saw with regard to your pain or symptoms. If every new specialist you go to gives you a new diagnosis and a new treatment method, there's something majorly flawed with the pain management industry. It just doesn't make sense. So keep that in mind as you plan to go to specialist to specialist to specialist. And oh, by the way, just a side note, the more time you spend on the internet Googling your symptoms, WebMD and Wikipedia and other places like that, the worse you're going to get. And that is because every time you see a new description or a story about somebody who had similar something and they were diagnosed with something horrific, all that does is escalate your pain levels. And I'm not suggesting research isn't a good thing, but you can absolutely go overboard on it. You can become obsessed with your symptoms. You can become obsessed with researching because it hurts, so you got to fix it. But I'm here to tell you, stay out of these, stay off the internet when it comes to researching your symptoms. And oh, by the way, some of these pain groups on Facebook, also it's a slippery slope, guys. All you're doing is, let's say you go into a general back pain support group on Facebook, very slippery slope. You're going to pretty soon see and hear and engage with people who are sharing the worst horror stories you can imagine about everything that's gone wrong with them. And all that does is escalate your fear. You're going to say, oh my God, I'm going down the same path. I'm going to have the same exact issue. So you're much better off sitting in a lounger out in your backyard in nature breathing deep and meditating and smiling and enjoying the outside world than you would be in front of your computer for 10 hours a day trying to research things or engage with other people. Look, if you're looking for sympathy and feeling like you're not alone, the support groups are fine, but boy, they can definitely bring you down and cause so much more fear. So anyway, a little bit of a ramble here. The chronic pain management industry is just that. It's an industry, it's a business. And honestly, you know, I talk a lot about Dr. Sarno and the mind-body syndrome and what I just call distraction pain. If that were widely embraced, you know, I think the numbers I saw were about $600 billion a year that chronic pain costs in the United States alone, so it's trillions around the world. But if Sarno's theories and this distraction pain theory were to really become widely accepted, the pain management business would crumble. And that's why when you hear what I am suggesting is causing your pain, and you say, but my doctor never told me, my chronic pain specialist never told me, I never heard about this before. Of course. Because if they told you about it, they couldn't justify charging you and your insurance company all that money for their treatments that don't work. It's completely against their worldview. They weren't taught about this stuff in medical school. And through no fault of their own, they are just in the paradigm that they have been taught. So it's really going to be up to you to step outside of that and really have some independent thinking about yourself and your symptoms. And when I tell you that the vast majority of chronic pain is created by the brain to distract us from our overwhelming emotions, it's really up to you to research that and evaluate that for yourself. I said before, go through your pain history. What symptoms did you have throughout the course of your life? Everything. And then what was going on in your life at the time? Was there any stress, trauma, not physical trauma, but emotional trauma? Do your own analysis. Think for yourself. Stop running around from specialist to specialist to specialist, because all they're going to do is scare you more too. You know, every specialist you go see is going to say, well, I think it's this, so we're going to do this to you. And then it doesn't work. And then eventually some of these doctors will say, I don't know what to do for you. I don't know. This should work, but it's not. So I don't know what to do. And in some cases, these damn doctors will actually say, you better get used to it because you're going to be in pain the rest of your life because of X, Y, and Z on your imaging study or whatever. And my belief is, if a doctor ever tells you to get used to it, it's time for you to tell that doctor, shame on you. You should never tell a patient that they can never get better, and walk out and find a new doctor, or dig into this whole mind-body syndrome and distraction pain concept. Again, I don't believe any doctor has the right to give you a life sentence to a prison called chronic pain. So with that, I'm going to wrap it up. Thanks for listening, and we'll talk soon.